My name is Ashley Berg, and I will be doing my project on Mitchell's theory, which is a middle range theory. A middle range theory in nursing is a theory that is more focused and specific than grand theories, but not as detailed in practice. These theories are designed to be tested through research and can be applied to real world situations, which I'll go into a little bit later. So Mitchell's uncertainty and illness theory looks at how people feel uncertain and confused when they're facing an illness, especially when there's a lot of unknowns when it comes to their diagnosis, as well as symptoms and anything new that kind of comes about that can bring up that uncertainty. The uncertainty can cause stress and affect how people cope with their condition. So it is important that decision making and overall ability to manage their health is still allowed for the individual. It also highlights how nurses and healthcare providers can help by giving clear information and support to reduce uncertainty, helping patients feel more in control. So this relates to the person because in Mitchell's theory, the person is the individual that is dealing with the illness, and the uncertainty happens when they face situations that are unclear or unpredictable. The person actively tries to make sense of these unknowns, which affects how they cope emotionally and physically as well as mentally with their illness. Next one will be the environment. So the environment could include both internal and external factors. So some external factors would be like social support or family, friends, or something like that. The internal factors would include personal experiences or mental health and how the individual reacts to the illness. And furthermore, getting into health. So health is not just the absence of illness, but it's how well someone can cope with their illness, as I mentioned previously. So Mitchell's theory says that uncertainty can either harm or help a person's health. It really depends on how they manage the situation, and some internal and external factors can affect how an individual reacts to the illness and how to deal and cope with it. But if someone learns to cope with the uncertainty, they can adapt and improve their health. And in terms of nursing, nurses play a key role in managing uncertainty. They can reduce uncertainty by giving clear information, emotional support, and guidance. So I believe this area fits really well with the neonatal intensive care unit where I work, because it has been applied to the NICU. The findings of this study found that families reported feeling overwhelmed, and the study that I'm referring to is one that uses Mitchell's theory and applied it to their study on families and providers in the neonatal intensive care unit. And like I said, they found that families reported feeling overwhelmed by the unpredictable nature of their child in the NICU, and the healthcare providers discussed their role in managing these uncertainties. The study emphasized the importance of clear communication and emotional support for families facing challenges within the NICU. So nurses in the NICU, including myself, can create a supportive and informative environment and minimize uncertainty and improve the overall experience for both infants and as well as families. So one of the ways we can do this is by providing emotional support. Recognizing that parents may feel anxious and uncertain, and being able to educate them as much as we possibly can so that they are aware of what is going on at all points in the care of their child. So making sure that communication is open and empathetic will help reduce stress and anxiety. The next one will be encouraging family involvement. This could be through skin to skin or feedings or simply just giving a bath or something like that. Making sure that the parents or any of the caregivers feel that they still have a part in their infant's growth and development.